Hello and welcome. Today, we're diving into a rare and complex inherited heart condition known as Carvajal syndrome. Join us as we unravel its mysteries, exploring its causes, symptoms, diagnosis, and management. Carvajal syndrome is primarily caused by mutations in the desmoplakin gene, often abbreviated as DSP. Desmoplakin is a vital protein responsible for building and maintaining desmosomes. Think of desmosomes as the glue that holds heart muscle cells tightly together. These genetic mutations are typically inherited in an autosomal recessive pattern, meaning an individual must inherit 2 copies of the mutated gene, one from each parent, to develop the syndrome. While mutations in desmoplakin are most common, other genes involved in desmosome formation and function can also be implicated in some cases. Now, let's delve into the pathophysiology. The mutated desmoplakin protein disrupts the formation and function of desmosomes within heart muscle cells and also skin cells. This weakening of the cellular connections leads to progressive damage. In the heart, this manifests as dilated cardiomyopathy, where the heart chambers enlarge and weaken, impairing its ability to pump blood effectively. The loss of cellular cohesion also predisposes individuals to arrhythmias, or irregular heartbeats, which can be life-threatening. In the skin, disruption of desmosomes leads to thickened skin on the palms and soles of the feet, known as palmoplantar keratoderma, and woolly hair. Carvajal syndrome is an extremely rare condition. Its exact prevalence is difficult to determine due to limited research and potential misdiagnosis. It is primarily found in families with a history of the disease, and has been reported in various populations worldwide, though with a seemingly higher prevalence in certain geographic regions. More research is needed to accurately assess its true prevalence and distribution. The signs and symptoms of Carvajal syndrome can vary in severity, but typically present in childhood or adolescence. The most prominent symptoms related to the heart include shortness of breath, fatigue, chest pain, and palpitations, reflecting the underlying dilated cardiomyopathy and arrhythmias. Individuals often experience palmoplantar keratoderma, characterized by thickened and calloused skin on the palms and soles. Woolly hair is another hallmark feature, often evident from a young age. These skin and hair findings are highly suggestive of the diagnosis, especially when occurring in combination with cardiac issues. Diagnosing Carvajal syndrome requires a comprehensive evaluation. This typically involves a thorough physical examination, including assessment of the skin, hair, and cardiovascular system. An electrocardiogram, or ECG, is used to detect arrhythmias. An echocardiogram provides detailed images of the heart's structure and function, revealing chamber dilation and impaired contractility. Genetic testing is crucial to confirm the diagnosis, specifically looking for mutations in the desmoplakin gene or other related genes. A skin biopsy may be performed to examine desmosomal structure under a microscope. While Carvajal syndrome doesn't have distinct classifications or subtypes in the traditional sense, the severity and progression of the cardiac symptoms can vary among individuals. Some may experience rapid deterioration of heart function, while others may have a slower, more gradual decline. The presence and severity of palmoplantar keratoderma can also differ. This variability highlights the importance of individualized treatment plans. Currently, there is no cure for Carvajal syndrome. Treatment focuses on managing the symptoms and slowing disease progression. Medications, such as ACE inhibitors, beta blockers, and diuretics, are used to improve heart function and reduce the workload on the heart. Antiarrhythmic medications may be necessary to control irregular heartbeats. In severe cases of heart failure, a heart transplant may be considered. For palmoplantar keratoderma, topical emollients and keratolytics can help manage the thickened skin. Regular monitoring by a cardiologist and dermatologist is essential for optimal management. Since Carvajal syndrome is a genetic condition, primary prevention is not currently possible. Genetic counseling is crucial for families with a history of the disease. This provides information about the risk of inheritance and helps individuals make informed decisions about family planning. Early detection through genetic screening may be possible in some cases, allowing for proactive monitoring and management of cardiac symptoms. The prognosis for individuals with Carvajal syndrome can vary significantly depending on the severity of the disease and the effectiveness of treatment. Early diagnosis and prompt management of cardiac symptoms can improve the quality of life and extend survival. However, the progressive nature of the cardiomyopathy and the risk of sudden cardiac death remain significant challenges. Recent research is focused on developing gene therapies to correct the underlying genetic defect. Other promising avenues include exploring novel therapies to improve desmosome function and prevent cellular damage. Further research is essential to develop more effective treatments and ultimately find a cure for Carvajal syndrome.